Hello, I'm Robert Bunnell. I'm a physical therapist and instructor with GLS. I'm here at our kind of home base in Toledo. I'm going to show you folks the seated thoracic extension and flexion mobilization. It's a technique that I kind of add on to the class that I teach, which is advanced spine. Basically, what we're going to try to do is we're going to try to get our patient in a seated position where they're kind of in a comfortable position, and then I'm going to try to use leverage with my forearms to attempt to get the thoracic spine to extend or flex a little bit more than what they're capable of on their own. So it's a really cool way to get a bit of extension through the spine and hopefully get immediate relief of symptoms. All right, Tony's gonna put his feet flat on the floor, kind of in a relaxed position. We're gonna have him either on a chair or a backless stool. Regardless of what we're gonna be doing, we wanna make sure he's stable so that way he doesn't fall off the chair or the table or what we're using. It helps to be in a chair position just because it's lower and you'll have more leverage. What Tony's gonna do, he's going to take his forearms and he's going to cross them over each other and place them on his forehead like such. What we're going to do is we're going to take our arms, we're going to interlace them and kind of weave them through his arms. And we're going to try to take our fingers on the part of his thoracic spine that's looking to get mobilized the most. So we're trying to find that dysfunctional spot that doesn't like to extend or flex. Now, in order to perform an extension mobilization in this technique, what we're going to do is we're basically going to kind of lean back with our body weight and stand up. And what that does is it forces that thoracic segment underneath your hands to kind of extend in sort of like a leverage sort of position. So this is why I call them leverage mobs for short. Now, if Tony was having a hard time with flexion, instead of coming up into this extended position or leaning forward for an aggressive extension, what I can do is I can actually kind of come down and sit down into like a little bit of a squat. And what that does is it forces that same segment to flex. So this is using the same technique for a flexion mobilization. I can come down, I can go into extension, I can add a bit of rotation if I need. Okay, he's really tight, so he's probably gonna like this. And that's the technique. So that's the seated thoracic extension and flexion mobilization. Hopefully you can use this immediately the next time you're treating a patient, especially that person who's got that tricky thing that's where they're just stuck. And the cool thing is play around with it. It's a really cool technique. You can add that rotation. You can tease into a little bit of flexion or extension and add those little tweaks. There's a lot of different ways you can treat the spine, and hopefully I can see you at my advanced spine course. Thank you.